Welcome to PCA Responsibilities Explained, a beginner's guide. In this video, we will explore the vital role of personal care attendants, their daily routines, and the impact they have on the healthcare system. Personal care attendants, or PCAs, are essential members of the healthcare team, providing compassionate and personalized care to those in need. From assisting with daily activities to ensuring safety and comfort, PCAs make a significant difference in the lives of their patients. Whether you're considering a career as a PCA or simply want to understand more about this critical role, stay tuned as we delve into the world of personal care attendants. What does a typical day look like for a PCA? Well, no 2 days are exactly the same, and that's part of what makes this role so dynamic. Imagine starting your day by assisting someone with getting dressed, preparing a nutritious breakfast, and ensuring they take their medications as prescribed. Throughout the day, you might help with bathing, toileting, and other personal care tasks, always treating your patient with dignity and respect. You might engage your patient in conversation, play games, or accompany them on walks, brightening their day and fostering a sense of connection. And let's not forget about safety. PCAs play a crucial role in creating a safe environment for their patients, preventing falls, and reporting any concerns to supervisors or medical professionals promptly. Being a PCA requires more than just technical skills. It demands a special kind of person with the right qualities and mindset. Empathy, patience, and a genuine desire to help others are paramount. Excellent communication is also key. You'll be interacting with patients from diverse backgrounds, some of whom may have difficulty communicating their needs. Active listening, clear articulation, and the ability to build trust are essential for effective caregiving. And let's not forget about physical stamina. PCAs are often on their feet for extended periods, assisting with mobility and transfers. As a PCA, you'll be an integral part of a larger healthcare team, working alongside nurses, doctors, therapists, and other professionals. Collaboration and communication are vital to ensure patients receive the best possible care. You'll be responsible for observing and reporting any changes in your patient's condition, accurately documenting their care, and promptly relaying any concerns to the appropriate team members. Teamwork also extends to families and loved ones. You'll be interacting with them regularly, providing updates on the patient's well-being, answering questions, and offering emotional support. Remember, as a PCA, you play a vital role in the healthcare system. Your dedication, empathy, and commitment to providing exceptional care can make a world of difference in the lives of those you serve. Now let's dive into the specifics of PCA responsibilities, starting with personal hygiene. This is a fundamental aspect of caregiving, and it's about so much more than just keeping someone clean. Imagine assisting someone with bathing. This could involve helping them get in and out of the shower or tub safely, providing support while they wash themselves, or even providing a bed bath if they're unable to get up. Oral hygiene is another crucial aspect of personal care. You might assist with brushing and flossing teeth, caring for dentures, or providing mouthwash to keep their mouth fresh and healthy. For patients who are bedridden or have limited mobility, special techniques may be required to ensure proper oral care. And let's not forget about toileting needs. Assisting with using the toilet, providing bedpans or urinals, and maintaining continence products are all part of a PCA's role. These tasks require empathy, discretion, and a commitment to maintaining your patient's dignity at all times. Helping someone get dressed and ready for the day might seem like a small task, but it's an important part of maintaining their independence and self-esteem. As a PCA, you'll encourage your patients to do as much as they can for themselves, providing assistance only when needed. Imagine helping someone choose an outfit for the day, considering their comfort, preferences, and any physical limitations they might have. Grooming is another important aspect of personal care that goes beyond just hygiene. It's about helping someone feel good about themselves. This could involve combing or brushing hair, shaving, or applying makeup if desired. For some patients, dressing and grooming might be challenging due to physical limitations, cognitive impairments, or pain. In these cases, patience, understanding, and creativity are key. Medication management is a critical responsibility of a PCA, and it requires a high level of attention to detail and a commitment to safety. While you're not administering medications intravenously or performing complex medical procedures, you play a vital role in ensuring your patient takes their prescribed medications correctly. Imagine starting each day by reviewing your patient's medication list, checking for any changes or updates from their doctor. Depending on your patient's needs and abilities, you might assist with opening medication bottles, sorting pills, or reminding them when it's time to take their medication. For patients who have difficulty swallowing pills, you might need to crush medications and mix them with food or liquids, always following proper procedures and safety guidelines. Accurate documentation is essential for medication management. You'll need to keep detailed records of what medications were given, the dosage, the time of administration, and any observations or concerns. For many patients, maintaining mobility and independence is a top priority. As a PCA, you'll play a vital role in helping them move around safely and comfortably, whether it's getting out of bed, walking down the hall, or navigating stairs. Imagine assisting a patient who is recovering from surgery and needs help getting out of bed. You might use a gait belt to provide support, encourage them to use a walker or cane, or assist with transfers to and from wheelchairs. For patients who are bedridden or have limited mobility, you might assist with range of motion exercises to prevent muscle stiffness and promote circulation. This could involve gently moving their limbs through a series of movements, always being mindful of their comfort level and any pain they might be experiencing. Remember, safety is paramount when it comes to mobility assistance. Before assisting with any transfers or ambulation, assess the environment for potential hazards, ensure the patient has appropriate footwear, and use proper body mechanics to protect yourself from injury. Food is more than just sustenance. It's a source of pleasure and a way to connect with others. As a PCA, you'll play an important role in ensuring your patient receives nutritious meals and enjoys the dining experience. Imagine starting the day by preparing a healthy breakfast for your patient, taking into account their dietary restrictions, preferences, and any swallowing difficulties they might have. You might assist with opening containers, cutting food into bite-sized pieces, or providing adaptive utensils to make mealtimes easier and more enjoyable. For patients who are unable to feed themselves, you'll provide assistance with feeding, ensuring they consume enough calories and nutrients to maintain their health. By creating a positive and supportive dining experience, you can enhance their quality of life and foster a sense of well-being. As we've discussed, being a PCA is about much more than just physical tasks. It's about connecting with your patients on a human level, understanding their needs, and providing compassionate care. And at the heart of it all is empathy, the ability to step into someone else's shoes and see the world through their eyes. Imagine for a moment that you're recovering from a stroke. You're facing physical limitations, difficulty communicating, and a whirlwind of emotions. Now, imagine having a PCA who approaches you with kindness, patience, and a genuine desire to understand what you're going through. Empathy means being attuned to your patient's verbal and non-verbal cues, their tone of voice, facial expressions, and body language. It means listening attentively when they speak, even if their words are difficult to understand. and it means responding with compassion and understanding even on challenging days. Patience. That virtue we often strive for but can be challenging to maintain, especially in the face of adversity. As a PCA, patience is not just a desirable quality, it's an absolute necessity. You'll be working with individuals who may have physical limitations, cognitive impairments, or emotional challenges, and patience will be your guiding star. Imagine assisting someone with dressing who has limited mobility. It might take longer than you expect, and there might be moments of frustration for both of you. But with patience, you'll approach the task with a calm demeanor, offering encouragement and support every step of the way. Patience also comes into play when dealing with repetitive questions, resistance to care, or unexpected behaviors. Building patience takes practice and a conscious effort to shift your mindset. Communication. The cornerstone of human interaction, and in caregiving, it's the bridge that connects you with your patients. Effective communication is about more than just words. It's about empathy and trust. Imagine explaining a new medication to a patient who's hard of hearing. Speak clearly, use written materials or visual aids. Comforting a family member requires compassion and clear explanations. Effective communication involves both verbal and non-verbal cues. Maintain eye contact, use a gentle tone, and be mindful of body language. Pay attention to their responses to ensure they understand and feel heard. Encourage patients to express their needs and preferences, listen attentively, and ask clarifying questions. Foster open communication to create a trusting caregiving environment. As a PCA, you're more than just a caregiver. You're the eyes and ears of the healthcare team. Your close proximity to patients allows you to observe subtle changes in their condition, which could indicate a need for medical attention or adjustments to their care plan. Imagine noticing that your patient, who usually has a hearty appetite, has barely touched their food for the past 2 days. Or perhaps you've observed that they're having difficulty finding the right words, which is unusual for them. These observations, however small they may seem, could be vital clues to underlying medical issues that require further investigation. Your observation skills extend beyond physical health. You might notice changes in your patient's mood, behavior, or sleep patterns, which could indicate emotional distress, medication side effects, or other concerns. By documenting and reporting these observations promptly, you'll play a crucial role in ensuring your patient receives timely and appropriate care. Professionalism, a word that encompasses a multitude of qualities, all essential for providing ethical, compassionate, and respectful care. As a PCA, you'll embody professionalism in your appearance, your demeanor, your interactions with patients and colleagues, and your unwavering commitment to ethical conduct. Imagine arriving at work well-groomed, in clean attire, and with a positive attitude, ready to greet your patients with a warm smile. You maintain confidentiality, treating all patient information with discretion and respect. You understand the boundaries of your role, seeking guidance from supervisors when needed, and never performing tasks outside your scope of practice. Professionalism also means being reliable, punctual, and prepared to fulfill your responsibilities to the best of your ability. By consistently demonstrating professionalism, you'll earn the trust of your patients, their families, and your colleagues, creating a positive and respectful caregiving environment. Empathy in action, real-life scenarios. Let's bring empathy to life with real-life scenarios. Imagine caring for Mrs. Smith, recovering from a hip replacement. She's in pain and frustrated with her limited mobility. Understand her perspective and adjust your care. Ask about her pain level, adjust her pillows, and offer words of encouragement. Respond with patience and kindness. Now, picture caring for Mr. Jones with a spinal cord injury. He's adjusting to life with a disability. Acknowledge his emotions and create a safe space. Offer support, without judgment. Listen attentively, celebrate progress, and advocate for his needs. Empathy is about showing up with an open heart. Section 2. The patience of a saint navigating challenging behaviors. Caregiving can be challenging, especially with difficult behaviors. Patients might resist care, have mood swings, or struggle to communicate. Patience is your superpower, helping you navigate with grace. Imagine assisting Mr. Garcia, an elderly man with dementia. He's agitated, refusing care, and his words are jumbled. Take a step back, speak calmly, and identify his distress. Offer a warm towel, reassure him, and redirect his attention. Patience is about finding creative and compassionate solutions. Empathy and patience aren't just feel-good qualities, they're the foundation upon which trust is built in the patient-caregiver relationship. When patients feel seen, heard, and understood, they're more likely to open up, cooperate with care, and experience a sense of safety and well-being. Imagine you're caring for Mrs. Rodriguez, a woman with a history of trauma. She's guarded, suspicious of new people, and reluctant to accept help. Building trust will take time, consistency, and a genuine desire to connect with her on her terms. Start by introducing yourself slowly, respecting her personal space, and asking permission before providing care. Be reliable, showing up when you say you will, and follow through on your promises. Over time, your empathy and patience will chip away at her defenses, paving the way for a trusting relationship. Remember, trust is earned, not demanded. It's built through countless small interactions, a listening ear, a comforting touch, a willingness to go the extra mile. By consistently embodying empathy and patience, you'll create a foundation of trust that will enhance your patient's care experience. Being an empathetic and patient PCA isn't always easy, but the rewards are immeasurable. When you approach your work with compassion, understanding, and a genuine desire to make a difference, you'll experience a level of fulfillment that transcends the daily tasks. Imagine the smile on Mrs. Smith's face when you take the time to brush her hair and tell her how lovely she looks. Picture the sense of accomplishment you'll feel when Mr. Jones, with your patient guidance, takes his first steps after his injury. These are the moments that make all the challenges worthwhile. Empathetic caregiving isn't just about meeting physical needs, it's about nourishing the human spirit. It's about recognizing the inherent dignity in every individual, regardless of their age, condition, or background. And it's about making a positive impact on their lives, one interaction at a time. So, as you embark on your journey as a PCA, remember to lead with your heart. Embrace empathy and patience as your guiding principles, and you'll discover the profound rewards of making a difference in the lives of those you serve. As a PCA, you're not alone on an island. You're part of a dynamic healthcare ecosystem, working with a diverse team dedicated to patient well-being. Think of it like a symphony orchestra, each instrument playing a vital role. Nurses oversee medication schedules, and doctors rely on your observations. Therapists help regain mobility, and you reinforce their instructions. Social workers address emotional needs, while administrative staff and cleaning crew ensure smooth operations and safety. You're the eyes and ears on the ground, gaining valuable insights into their daily lives. Communication breakdowns in healthcare can have significant consequences. Clear, concise, and timely communication is paramount. Convey vital information accurately. Imagine noticing a new rash on your patient's arm. Document and report it promptly. This could lead to early detection of a medical condition. Be specific, objective, and avoid jargon. Use clear and concise language. For example, say, Mrs. Jones reported a headache, dizziness, and nausea. She's also more fatigued than usual. Your observations are valuable. Speak up if you notice any changes. Early detection and intervention can make a world of difference. Collaboration in healthcare is like a well-choreographed dance. Each team member moving in sync, anticipating each other's steps, and working together towards a common goal, the patient's well-being. It's about pooling your expertise, sharing information, and supporting each other to provide seamless and comprehensive care. Imagine your patient is struggling to regain their mobility after a stroke. The physical therapist has designed a personalized exercise program, and you play a crucial role in reinforcing those exercises during your shifts. You encourage your patient, provide gentle assistance when needed, and celebrate their progress no matter how small. Collaboration also extends to care planning. During team meetings, your insights into your patient's daily routines, preferences, and challenges will be invaluable. You can provide feedback on what's working well, suggest adjustments to the care plan, and advocate for your patient's needs and wishes. Remember, you're an integral part of the team, and your contributions are valued. By approaching your role with a collaborative spirit, you'll contribute to a positive and supportive work environment where everyone feels empowered to provide the best possible care. Imagine yourself as a voice for those who might not be able to speak for themselves. As a PCA, you're in a unique position to advocate for your patients, ensuring their needs are met, their wishes are respected, and their voices are heard. Perhaps your patient is struggling to communicate their pain level to the doctor. You can advocate for them by providing specific examples of their behavior, such as grimacing, guarding their side, or refusing to participate in activities they usually enjoy. Or maybe your patient is feeling overwhelmed with decisions about their care. You can advocate for them by providing emotional support, helping them understand their options, and ensuring their preferences are considered in the decision-making process. Advocacy isn't about speaking for your patients, it's about empowering them to speak for themselves. It's about ensuring they have the information, support, and resources they need to make informed decisions about their care. It's about being their champion, their ally, and their voice when they need it most. Congratulations on embarking on this rewarding journey as a personal care attendant. As you step into this role, remember that every interaction, every task, and every moment of care is an opportunity to make a positive impact on someone's life. At first, it might seem overwhelming, like trying to navigate a new city without a map. But don't worry, you've got this. Start by embracing a beginner's mindset. Be eager to learn, ask questions, and don't be afraid to seek guidance from experienced colleagues. They've been in your shoes and are invaluable resources for practical tips and emotional support. Organization is key in this role. Keep a notebook handy to jot down important information, medication schedules, and any changes in your patient's condition. Familiarize yourself with the care plan, and don't hesitate to clarify any uncertainties with the healthcare team. And remember, communication is a two-way street. Encourage your patients to express their needs, preferences, and concerns. Listen attentively, ask clarifying questions, and create a safe space for open and honest dialogue. Caring for others is a noble calling, but it's also important to remember that you can't pour from an empty cup. Just as you prioritize your patient's well-being, it's essential to nurture your own physical, emotional, and mental health. Imagine yourself as a marathon runner. To cross the finish line, you need to pace yourself, stay hydrated, and fuel your body with nutritious food. The same principle applies to caregiving. Make sure you're getting enough sleep, eating healthy meals, and staying physically active. Emotional self-care is equally important. Caring for others can be emotionally demanding, so make time for activities that bring you joy and relaxation. Whether it's reading a book, taking a walk in nature, or spending time with loved ones, find what helps you de-stress and recharge. And don't hesitate to seek support when you need it. Talk to your supervisor, a trusted colleague, or a therapist if you're feeling overwhelmed, stressed, or emotionally drained. Remember, asking for help is a sign of strength, not weakness. Being a PCA is more than just a job. It's a calling where compassion and empathy converge. It's about finding fulfillment in the smallest of gestures, a warm smile, a listening ear, a helping hand. Imagine witnessing the power of human connection firsthand, the way a simple conversation can lift a patient's spirits, the shared laughter that fills the room. These moments fill your heart with purpose and remind you why you chose this path. Never underestimate the profound impact you have as a PCA. You are on the front lines of caregiving, making a tangible difference in the lives of your patients, their families, and the entire healthcare team. Imagine the ripple effect of your actions. The way your gentle touch can ease a patient's pain, your words of encouragement can inspire them to keep fighting, and your unwavering support can give their families peace of mind. You are a beacon of hope, a source of strength, and a testament to the power of human compassion. As you continue on your journey, remember that every day brings new opportunities to learn, to grow, and to make a difference. Embrace the challenges, celebrate the victories, and never lose sight of the profound privilege it is to serve others in this capacity. The world needs more compassionate, dedicated, and skilled PCAs like you. Thank you for choosing this path, for your unwavering commitment to caregiving, and for making a difference in the lives of those you touch.